Hey guys, welcome to Melbourne Acupuncture Centre. My name is Michael. I want to thank you for tuning into this video about the science of acupuncture. I'm going to do my best not to trip over my tongue as I go through some of these terms and present this information to you as best I can. So a lot of people think there's no scientific evidence about acupuncture. There's actually quite a lot of scientific evidence backing up acupuncture. So I want to just go into sharing some of that information which I'm presenting it to you in a way hopefully that makes it nice and easy to understand. So starting off, when we talk about acupuncture, we talk about acupuncture as being an evidence-based medicine. There's evidence supporting the use of acupuncture. Now, an evidence-based medicine applies the application of the best available, that is the most reliable evidence gained from the scientific method to guide clinical decision making. The most rigorous evidence comes from meta-analysis of multiple double-blinded placebo-controlled clinical trials. Okay, that's a bit of a mouthful. That's the soundbite. What that means is we're using meta-analysis where we're taking the analysis of lots of different studies and combining it, and we're using the analysis of multiple double-blinded placebo-controlled clinical trials, which are the gold standard for scientific research. And that's where we start with the therapy or the treatment or whatever the case may be. It might be a medication, or in our case it's acupuncture. We compare it to a sham treatment. If it's medication, it's often just a sugar pill. In our case, it's a sham acupuncture treatment where we simulate the insertion of a needle. And we compare that to no treatment at all, and we look at the variation in results between those, and that's the gold standard for scientific research. The number of trials in our sample study here, we're comparing acupuncture with physiotherapy, nursing and chiropractic, and there is a significant difference. Nursing coming out on top with almost 11,000 studies as of 2017, so this is coming from a while back, so there's been more studies since then. Nursing comes out on top. Nobody would ever dare question nursing. It's ridiculous to think that nursing is not just incredibly effective and highly valued. But surprisingly, acupuncture comes in with over 8,000 studies, which is more than physiotherapy and chiropractic combined. And these therapies are often more accepted than acupuncture. So there's a lot of research into acupuncture. And the interesting thing is that the growth in acupuncture research is double that of all the other biomedicines combined. So it is growing rapidly. There's a huge push for research into acupuncture coming from both East and West. So the Acupuncture Evidence Project is a project set up by two acupuncturists in Australia, Jantz and McDonald, and they have done incredible work compiling all of the information from these trials and coming out with the outcomes of those. So based on their research so far, there is strong evidence supporting the use of acupuncture for 8 conditions. There's moderate evidence for 38 conditions. There's weak or positive or unclear evidence for 71 conditions. And there's little or no evidence for 5 conditions. And they're all the conditions that have been trialed so far. Now 8 might not seem like a lot when you're looking at those numbers, but back in 2013 there were only 3. So that's grown quite a lot in that short space of time. Now the reason why there's a small amount of conditions with strong evidence is because the vast majority of acupuncture research is into pain. So a lot of the conditions that we treat are not being scientifically studied at the moment because pain is where it's at. That's what people want to know about, that's what they want to research. So when we look at the 8 conditions for which there's strong evidence, we see there's migraine prevention, headaches, low back pain, knee osteoarthritis, allergic rhinitis, chemotherapy-induced nausea and vomiting, post-operative nausea and vomiting, and post-operative pain. So quite a number of those are pain-related, as we can see. According to the European Journal of Integrative Medicine, by November 2015, they had found over 870 recommendations for acupuncture for over 100 conditions from multiple international groups in over 30 countries. As of August 2017, that number was 2,189, and I can only assume it has grown since then. So in an analysis of patient-level data from 29 high-quality randomized controlled trials, so we say that's the gold standard of scientific research, 29 high quality trials, including 17,922 patients, almost 18,000 patients, which is a large group. They found statistically significant difference between both acupuncture versus sham acupuncture and acupuncture versus no acupuncture control for all pain types studied. And that's a study by Vickers in 2012. They found the effects were persistent over 12 months. So what are those statistical differences? Well, 30% of patients had a reduction with no acupuncture. So they did nothing for the year, and eventually 30% of them felt a reduction in their pain. 42.5% had a reduction with sham acupuncture, showing that the placebo effect is quite strong. And 50% had a reduction with acupuncture. That's statistically significant in a scientific study, because it shows it's more than just placebo effect. Although we can't eliminate or rule out how strong the placebo effect is, the thing with this is, though, with the placebo effect, it is not specific to acupuncture. It is a factor in acupuncture treatment. We're not denying that at all, but it's a factor in all forms of treatment, whether it be medication or even surgical interventions, and we'll look at that information. In the USA, a 2-year retroactive study of 89,000 patients indicated 93% responded that acupuncture was effective in treating their primary condition, indicating that real-world data was more positive towards acupuncture than trial data. What I find interesting about that number of 93% is it's almost the same when you compare the sham acupuncture and the acupuncture results, which is 92.5%. So it goes to show that we cannot rule out that placebo effect with it, but as we're going to look at later, that's with all medicine. But it's pardon my tongue tied, it's statistically significant, the difference between sham and regular acupuncture and acupuncture and no acupuncture. So, in relation to the placebo effect, we're talking about measured levels of placebo effect in various therapies. This information comes from Dr. Martin Wang, who's authored a book called More Than Acupuncture. And he's done this based on studies in China. He's compiled, again, meta-analysis of lots of different studies. He estimates that the placebo effect with acupuncture is 23%. The placebo effect with physiotherapy is estimated at 20%. The placebo effect with chiropractic care is estimated at 17%. With pharmaceutical medicine, it's 31%, and with surgical procedures, it's 37%. So even when you have an operation, there is a placebo effect associated with it. That's not to say that there's not an actual effect. Obviously there is. Same with actual medication. There is an actual measurable effect for a lot of medications, but 31% of that effect can also be attributed to the placebo of thinking that it's working for you. And so it's no different for any therapy at all. Once your mind is on board with the healing process, it goes a long way to helping you get better. So when we're comparing the studies between East and West, we're finding that there's a discrepancy between the positive outcomes. There's a lot more positive outcomes coming from the East, particularly from China, than there is from the West. And so a lot of people use that as evidence that there is questionable methods being used in the studies. But we believe that actually what's happening is a lot of the studies in the West are not necessarily sticking to the same rigid parameters that they are in the East. So for example, in more than 40% of acupuncture trials, acupuncture was performed by a non-acupuncturist. Now, as an acupuncturist, that's going to have a significant effect on the actual outcome of the treatment. We believe strongly that the ability of the practitioner has a big role to play in the outcome of the treatment. So if 40% of people administering treatment in the trials are not actually acupuncturists, that's really going to affect the outcome, and it's going to reduce its effectiveness. Another issue that we're seeing with acupuncture trials, particularly in the West, is the improper choice of acupuncture points contribute to the low effect of the acupuncture in the randomized controlled trials, why we're getting probably inconclusive results. So for example, Neguen is a point. It's here just above the wrist. It's on the pericardial meridian, and we use that point for nausea, vomiting. It's very, very effective. We use it for other things, but that's one of its key uses that it's well known for, and that was one of the key uses it's used in clinical trials. The thing is, in clinical trials, it has been used on its own, just that single point, and has been found to be inconclusive. Whereas acupuncturists don't use that point on its own. We always use other points to support it and augment its usefulness, to potentize it by perhaps treating an underlying pattern of disharmony which is giving rise to the nausea and vomiting. So while it can be effective in use with other points, which we always do as practitioners, on its own it's less effective, and that's going to have an effect on its trial data. The other one is the acupuncture point Zeus Sanli, and I always describe Zeus Sanli as like the grand central station of acupuncture points because it's so effective at so many things. The key things it does is it strengthens chi and it strengthens blood. And because it strengthens blood, it's been used in randomized controlled trials to test its effect on the heart. And it's been found that it doesn't have much of an effect on the heart. As an acupuncturist, that's no surprise to us because Zeus Sanli is actually on the stomach meridian. So it's going to have very little effect specifically on the heart. Again, we use a point in conjunction with other points to treat an overall pattern of disharmony. So if it's used in isolation and it's used in isolation to treat the heart, you're not going to get great results from that. And we find that in a lot of the randomized controlled trials that has been the case. So it's really going to affect the outcome. So a lot of the inconclusive studies into acupuncture, we believe, are actually inaccurate because of the method that's being used to come to that result. Now, the interesting thing about randomized controlled trials is you cannot prove a negative. You cannot prove that something doesn't work. You can prove that it does work by showing data to support its efficacy, but you can't prove it doesn't work. All you can say is that there are no evidence supporting it. But no evidence supporting something is not the same as proving it doesn't work. So as technology improves and as the methodology changes, we often see the results for acupuncture improving with the studies. So once we prove acupuncture works, and as we do in randomized controlled trials, particularly for pain, we show that it is statistically effective for pain compared to the alternatives, well then that negates all other trials that say it doesn't work for pain, because it's proved. Because the other trials didn't prove it didn't work, they were just inconclusive. And once you get a positive, it's proof it works. One of the other things that affects the actual outcome of studies, particularly in the West, is the low treatment frequency and the low total number of treatments. We find that there's actually a higher number of treatments and they're more frequent in studies in China than they are in the West. And that results in a much more positive outcome with the studies that take place in China as opposed to the West. And again, these are factors. The variations in how the studies are carried out show that there are serious discrepancies in the methodology, and we question then how accurate the studies which don't support acupuncture are. So in a network meta-analysis comparing different treatments for sciatica, acupuncture comes in second behind biological agents. So it's coming in ahead of manipulation, intraoperative interventions, epidural procedures, spinal cord stimulation, disc surgery, non-opioids. Opioids coming way down below non-opioids. It's coming in ahead of all these things, all the normal things you think of going to, whether it be Nurofen, other forms of ibuprofen or paracetamol. Acupuncture is coming in ahead of all of those things in terms of treatment for sciatica. So the big question then is, how does it work? How does it actually, what's the mechanism for acupuncture to actually work? And again, we're talking about the scientific studies that have taken place into it. So, in relation to the nervous system, when a needle is inserted into a point, the needle stimulates the sensory or afferent nerves. We know this because if we cut the afferent nerves or cut the effect of the afferent nerves, it eliminates the effect of acupuncture. When we cut the effect of the efferent motor nerves, it doesn't have any effect on the effectiveness of acupuncture. So we can see there's a direct correlation between how acupuncture works in relation to the sensory nerves. It affects sensory nerves rather than motor nerves. And sensory nerves are the ones that carry that pain signal. Motor nerves, that's the motor nerve moving the arm. Yeah. Where the sensory nerve is the one that tells you what you're feeling, or if there's any pain, that's the sensory nerve kicking in. So we have a study here which is being overseen by Dr. John Longhurst. In this, he says, we have conducted a large number of studies, over 40 in total, showing that electro and manual acupuncture applied at specific acupuncture points lower short-term elevations by about 50% and long-term elevations in blood pressure through stimulation of sensory nerve fibers underlying the acupuncture points. The thing about this is, unlike pain, which is subjective, blood pressure is measurable. It's a measurable outcome. So we can see very clearly that acupuncture is having an effect. Pain, you know, you can ask somebody how they got less pain, they might say yes, but that's relative to them and how they're feeling on that particular day. Whereas blood pressure is very, very measurable. So we can see very clearly that it works. I talk about the acupuncture meridian in relation to the nerves. Now, there's no evidence to say that acupuncture meridians are nerves. We don't believe that. But we do believe there's a correlation and a relationship, a strong relationship between the actual acupuncture meridian and the nerves. And when we look at the maps of the acupuncture meridian superimposed on the peripheral nerves of the arms and legs, we can see there is a direct correlation. It's almost a direct map of them. When we look at a functional MRI scanner and we look at how it affects the brain, we can see that when we stimulate acupuncture needles, the brain lights up in different ways depending on what we're doing. We can see that it stimulates the parasympathetic nervous system, that relaxation response. And it reduces the sympathetic nervous system, the fight or flight response. And we can see it very clearly in the different parts of the brain that light up. So that we say acupuncture stimulates peripheral nerves, triggering a cascade that causes changes in the brain and the internal organs. The peripheral nerves, the sensory nerves, carry the signal through to the brain, and it has an effect there. Acupuncture also stimulates the release of endorphins. Endorphins are endogenous morphine, the morphine produced within your body, and it's a pain-killing neuropeptide. So when we have pain, the body releases endorphins to ease that pain. Sometimes something goes wrong and the body stops producing endorphins to ease pain. So that's when we have to take morphine or an external form of painkiller to replicate that or to replace it. Acupuncture stimulates that endorphin to be released, so we don't necessarily need to take as much morphine. So when we look at it, we see certain correlation between the effects of morphine, how morphine works, and how acupuncture works. Naloxone prevents the effect of both morphine and acupuncture. So there is a correlation there. CCK8 is a hormone. People who have high levels of CCK8 don't respond to acupuncture as well. There's been studies which have been carried out as well on mice. We'll see that later in the next slide. With the CCK8 being a non-responder to acupuncture, it also causes people to be less sensitive to the effects of morphine. So again, we're seeing that correlation between morphine and acupuncture. So acupuncture increases sensitivity to morphine. When you receive acupuncture, you need less morphine to treat pain. And CCK8 and naloxone both inhibit acupuncture and morphine. And the other thing with acupuncture is it stimulates the release of ATP, adenosine triphosphate. That's the unit of energy of the cell. Every cell in the body produces ATP from the mitochondria and they use it to function. That's their energy. When ATP is released from a cell, it degrades to adenosine. And adenosine is a signal molecule and a pain reliever. So what we have is, initially we have the stimulation of energy. Acupuncture stimulates the energy, and once the ATP starts to degrade, then it has a pain-killing effect. So we have the release of the endogenous morphine, the endorphins, and then we have the release of the ATP giving us energy, and once that degrades, we have a continuation of the energy of the pain-killing effect with the release and the degradation to adenosine. So there was a study carried out by Goldman in 2010, and they carried it out initially on mice and then on people. And they had people who had a particular A1 receptor for ATP. And they found that acupuncture was only effective in mice with the adenosine receptors. So further to that, in 2012, Takano carried out a human study. They said the interstitial adenosine concentration increased significantly during acupuncture and remained elevated for 30 minutes after acupuncture. Acupuncture-mediated adenosine release was not observed if acupuncture was not delivered in the Zusan Li point or if the acupuncture needle was inserted but not rotated. So we spoke about that Zusan Li point before, being like the grand central station of acupuncture points, the one that stimulates the energy, the qi, stimulates the blood production and movement. And we can see here that Zusan Li, when it's rotated, really stimulates the release of that adenosine. So it stimulates the release of the ATP on a cellular level, energy on a cellular level of the body. So in relation to adenosine levels increase in areas of inflammation and hypoxia, where it protects tissue by restoring the oxygen supply-demand ratio. So hypoxia is when there's a lack of oxygen in a particular area, as well as affecting preconditioning, exerting anti-inflammatory effects and stimulating angiogenesis, angiogenesis being the creation of new cells. Adenosine favors the resolution of pathologies such as epilepsy, pain, ischemia, inflammation and cancer, in which it behaves like a guardian angel against cellular damage. And there's a lot of research taking place now into drugs which are based on adenosine to treat all of these conditions. And adenosine is that thing that's produced naturally in the body. And again, we're producing drugs to replicate something the body can do itself, but for some reason is not doing it. And this is where acupuncture can step in and can stimulate the release of ATP, adenosine triphosphate, and subsequently adenosine itself. So what can we say about acupuncture then from that perspective? We can say acupuncture stimulates the body to release its own natural painkillers. It also stimulates the release of molecules associated with tissue healing and disease resolution. And we're basing this on the scientific research. So it's not about the other conditions that we say acupuncture treats for which there's no evidence. This is purely on the condition, specifically pain, for which there is strong evidence of acupuncture working. More about the mechanism of acupuncture in terms of the fascia and the fibroblasts. So the fascia is the connective tissue of the body. It covers all of the organs and it covers the muscles, and its job is to hydrate, to nourish the muscles and organs. So when we insert an acupuncture needle, and we can see in the diagram, it goes into the fascia, and when we turn it, which we often do, we either do a clockwise or anti-clockwise motion, it grabs and stretches those fibroblasts and it stimulates them. So when the needle is inserted, it stimulates and stretches the fascial fibroblasts and they granulate, causing a cascading effect. Fibroblasts are cells that maintain the structural integrity of connective tissue and play a crucial role in wound healing. They are the most common connective tissue cells in animals. And therefore we say acupuncture stimulates the body to release its own natural painkillers. It also stimulates the release of molecules associated with tissue healing and disease resolution. And we're basing this on the evidence. That evidence has come from all of the research which has taken place. So we want to say thank you, a big thank you, first off to the Acupuncture Now Foundation, who are really furthering the research and the collation of that information. Evidence-based acupuncture, and specifically Mel Hopper Koppleman, who put a lot of this information together that's taken place in this presentation. And also the Acupuncture Evidence Project that we mentioned earlier. John McDonald and Jantz, two Australian acupuncturists who've done just a huge amount of work. And as a profession and as a person, I have great gratitude for all of the work that we've done, and we acupuncturists should be very grateful for all of the work they have done. So thank you to all you guys for doing that. I appreciate it. And thank you so much for taking the time to listen to me today, ramble on about the science of acupuncture. I hope you found it interesting. I find it really fascinating, and I'm grateful for all of the great research which is taking place. So you can contact us on melbourneacupuncturecentre.com.au. Our Facebook page is Melbourne Acupuncture Centre. info@melbourneacupuncturecentre.com.au. You can contact by phone on 0403 555 806. I hope you enjoy the presentation. Thank you, guys. Take care.